coolers now too, Tim? I wonder if they have the new effects. Whatever. Let's play something else. I'm gonna play appendectomy surgery. Cause yeah! Interactive natural childbirth. Get it now at the App Store. Okay. Okay, interactive natural. I'm gonna actually capture that ad. Let's just look at that. I'm gonna actually, let me, that'll be at the top of the cast while I play the rest of my game. I'll be advertising it. I'm sure they'll pay me. I always wanted that app. Interactive natural childbirth. The app. Okay, thanks. Thanks. I'm glad you have it. Okay, before you scrub in, surgery may contain graphic procedures inappropriate for children or squeamish adults. Surgery Squad is not substitute for professional medical advice. I can perform an appendectomy right now on myself. Oh, this is gonna be bad. Why is natural childbirth like everything? I really don't want to see a baby just covered and crying in afterbirth. Crying and covered in afterbirth. I didn't think I'd be saying that today.
Welcome to Surgery Squad's virtual laparoscopic appendectomy.
I'm gonna do
I'm Dr. Jeff, and I'll be assisting you with this surgery today.
Okay.
An appendectomy is needed when there is a blockage between a patient's appendix and intestine. The blockage develops over time and may cause occasional pain. However, left untreated, the patient's appendix could burst, causing severe internal infection
This is
and
gonna be
potentially
realistic,
death.
guys. Apparently, Nicole's super
Today
excited
we'll
for
be
this.
using a minimally invasive technique called
It is realistic because there's
laparoscopy to remove
pictures.
our patient's appendix. Laparoscopy reduces the exposure of internal organs to contaminants, shortens recovery time, and results in less post-operative scarring.
I can pause it. Can I move ahead?
Our patient is a female in her 20s that has been experiencing severe pain in her mid-abdomen, vomiting, and a mild fever.
I'm bleeding so much.
These are all common symptoms of appendicitis.
Uh-oh.
Let's scrub in before this gets any worse.
Wash your hands.
Our patient has already been prepped and is sedated, thanks to our dedicated nursing staff and anesthesiologist. First, we'll insert an endotracheal, or breathing tube, in the patient's mouth and into her throat to help her breathe during the operation.
Oh, I get to do that. I don't want to miss you. Put it in your eye or anything. Nope. Up your nose. Nope. Really close. I caught it.
Since I've already taken care of inserting a catheter into her bladder, we can move on to more important steps.
I didn't want to do that, so thanks.
Thanks to the advancements in medical technology,
Please don't hold that so close to my
doesn't
nose.
have to be cut open to have her appendix removed. Instead, we'll strategically place special surgical instruments, called trocars, through small incisions in her abdomen to perform the surgery.
Somewhere else, I don't know.
We'll begin by making one small incision in her upper abdomen,
belly button,
one in her lower abdomen, and one in her navel, also known as the belly button.
Wait, that's what that's called? Oh god, you already put it in. Rip! Oh my god, okay. Okay, just keep using it. Just slicing on through. Oh my god, this is perfect and a half. Oh, yay.
You handled that like a pro.
I did, didn't I?
Now we need to pump carbon dioxide gas into the patient's abdomen to obtain a better look at the surgical area.
Okay, let's pump carbon... Really? Really?
Next, we need to insert our laparoscopic camera through the umbilical trocar.
What?
Images from the camera are projected on our monitor
way over
to allow
my
us
head
to inspect our patient's abdomen and confirm that the appendix is infected.
Okay, you could just call it a camera, I don't know. Go in deep.
The inflamed and swollen area you see is the patient's appendix.
Ah!
Our next step is to remove it before it becomes an even greater problem for our patient.
Okay.
The appendicular artery needs to be sealed using a diathermic instrument which uses extreme heat to cauterize the artery.
I thought it was just going to be cauterizing. When I saw that, I was like, cauterizing.
The artery is then divided using scissors.
Okay, we'll just cut it anyways. Good!
So far, so
Why
good.
Why do we cauterize it? Oh, probably so it doesn't bleed.
The appendix now needs to be lassoed with a detachable snare. Take the detachable snare and slide it over the appendix all the way to the base.
Okay.
Repeat this step 2 more times, placing 2 more loops above the first one.
Oh, I got you. Okay, so cinch that off, and then cut it, and then 1 more loop. 1 more loop. This one's all me. Ah, yeah, here we go. Clicked. Now snip it. Your appendix is not looking good, I'm sorry. Oh, we are actually oh, right down the middle. Don't pop it. Oh! Oh, that looks bad.
Almost there.
Oh, we're not doing good.
Now we need to remove the appendix. Use the scissors to snip between the loops. Notice that when you snip, a little pus comes out, indicating that the appendix is infected.
Yay!
Don't worry about it, though. We'll clean up everything. To remove the appendix
We'll do
from the
everything
abdomen,
else.
place it into this specimen bag and pull it out through the trocar.
We put the specimen bag inside of her. I don't think that's what anyone does. You don't put the specimen bag.
Now on to the cleanup.
Okay.
We've inserted a device that sprays saline into the abdomen. Move it around so that everything gets sprayed clean.
Oh, I have to click.
With a flick of a switch, our saline is suctioned back into the same device.
Okay.
Finally, we'll remove the trocars and close the incisions with a few surgical staples.
Staple. This'll do it. Could you just put a band-aid on it?
Excellent work.
Okay. Yeah.
The length of the inpatient
Look at
care
this
and
guy.
recovery process
Yeah,
following
yeah.
an
Look what I
appendectomy
got
usually
done.
varies based on the severity of the appendicitis and
yeah.
the person's age.
Okay.
Luckily, our patient is relatively young and healthy, and we
that
caught
a
her
real
condition
picture?
early.
I think that
She
is.
should be cleared to go home within a day if there are no complications. After
all
being
cost.
released from the hospital, it is recommended that she limit her physical activity to help the tissues heal faster.
Why did you
But she will need
show
to
a
walk
picture
short
of
distances
jogging
several
if you're
times
like,
a
don't
day to
jog?
speed up the recovery process.
Okay.
She should make a full recovery from her appendectomy within 4 to 6 weeks, since her
She'll have a
appendix did
nice,
not rupture.
healthy red
Had
glow.
it ruptured, a full recovery may have taken up to 8 weeks.
Whoa.
And that's an
Gonna fly.
appendectomy. You did amazing. Why not try your surgical skills in another surgery
How to
here
cook a
on
turkey!
surgerysquad.com.
Uh-oh. And about the removal of a cancerous tumor. Let's not do childbirth. That's what I'm not going to do at all. I don't know, guys. Who wants to do more surgeries? I kind of do. I kind of do. You have a huge scar on your stomach. I like how they showed in this one, you get like 3 little scars, but apparently whoever did yours was just like gouging it out and like, yeah. I can't do childbirth. More surgery? Cook the turkey? Do it. Do it. Oh, dude, I don't want to do a mastectomy. Learn about the removal of a cancerous tumor. As long as it's just a cancerous tumor and has nothing to do with the big anything. The germatalia. Okay. Interactive childbirth. I like how it's interactive. Like, you can really take part. Before you scrub in. Okay. Okie dokie. Somebody seems to have a really cool piercing in their armpit. I'm excited. You guys ready? You guys ready? I don't think anyone's ready, personally. I don't see anyone. Nobody's ready. Not a soul. I did already cook a turkey, so they have a C-section surgery. Do they show the naughty bits? They probably do if you're having... It's a C-section. Like, I mean... I guess you could cut into it and, like, keep the camera up, but, I mean... Whatever, I don't really want to do a C-section. That sounds bad! Sounds like not a fun time.
Welcome to Surgery Squad's virtual mastectomy.
Yes.
I'm Dr. Susie, and
Hi,
I'll be helping you with this
That's
procedure
such
today.
I'm sorry. That's such a stupid
mastectomy
sounding name.
is a surgical
Uh-oh.
procedure that is used to
Don't
remove
look.
one or both of the breasts in the event that an individual
Oh, is
develops
it?
breast cancer.
Oh, well, I guess I shouldn't be
If you're not
doing
familiar
this.
with the condition,
I
breast
wasn't.
cancer-
I'm glad that you told me before we did it. Wow, there is lumpectomy. Can we do lumpectomy? Let's do lumpectomy. I'm sure that actually is a term. But I think it sounds silly. A double mastectomy. I don't know. Laser tattoo removal. Botox. I've done Botox. Silicone breast implants. Saline breast implants. Liposuction. Oh, I thought that was someone's ass. Laser hair removal, hair transplant, rhinoplasty, which is like the worst one ever. Lumpectomy is breast cancer. Well, I would not know. This is all cancer. I guess all the cancer is breast cancer, specifically. Eye surgery was pretty bad. There's the C-section. That's the worst! Sorry, I forgot the toenail. The ingrown toenail one. Braces! Wisdom tooth! Oh, I still have mine. I don't want to see that. Oh! Oh no! They have carpal tunnel. I heard about carpal tunnel when I was like in grade 7 in my computer class. I don't want to do carpal tunnel. Like I see that. It doesn't look good, guys. Who wants to do carpal tunnel? Oh my god, my hands are gonna hurt after viewing this one. Carpal tunnel, carpal tunnel. Oh shit. Oh man, all the videos they had in my grade 7 computer class. Oh wow, that's an image. You guys ready for carpal tunnel? Yay, childbirth. Yeah. Oh baby, this is gonna be. Yeah, for anyone that's squeamish, including me, like, this is pretty
Welcome
bad.
to Surgery Squad's virtual limited open carpal tunnel release surgery. I'm Dr. Jeff, and I will be guiding you through the procedure today.
Dr. Jeff and
Carpal
Dr.
tunnel
Susan.
syndrome is characterized by a
This is gonna be
tingling
so
numbness or
bad.
pain in your
Like,
hand, and
ridiculously
sometimes
bad.
forearm. It develops due to the swelling of a ligament in the
Whoopsies.
wrist, known as the transverse carpal ligament. The swelling of the transverse carpal ligament creates pressure on the median nerve in your wrist. This nerve is responsible for supplying feeling and movement to various parts of the hand. Performing repetitive motions with the hand or wrist over a long period is the main cause of carpal tunnel syndrome, and the condition is more commonly seen in women than men. Researchers have also discovered that other medical problems such as alcoholism, arthritis, diabetes, obesity, and infections could also lead to carpal tunnel syndrome.
Fat people lose.
Today we'll be operating on a patient who has been diagnosed with carpal tunnel
This is gonna
syndrome
be so bad.
after experiencing numbness and weakness in the palm of his hand and thumb.
I'm so
Now let's put on our gloves and get started.
No, please
The
no.
limited open carpal
I'm
tunnel
gonna take my
release
hands.
surgery
Just-
is performed
just gonna
using a local
take a break
anesthetic
for a
that
second,
numbs the
'cause,
carpal
oh,
tunnel
shit.
area of the hand and wrist.
I don't want to do whatever you're
If the
saying. I
patient
don't
is
hear you.
nervous or uncomfortable,
Nope, do
I'll
not hear
sometimes
you.
use a
It's
sedative
over.
as well.
I don't hear
A
anything you're
sedative
saying.
is a drug given through an IV that places the patient in a dreamlike state. However, our patient today will only receive the local anesthetic. Go ahead and get the operating area numb.
Okay. Okay. I'm sorry, but anything with my hand is just absolutely terrifying, so this is all not fun for me. This is just needles. This is like phase 1. I like how I was drifting
With the
too,
wrist
like,
anesthetized,
stab
we can now
move.
begin the operation.
Oh,
I've
shit.
already tied a tourniquet around the patient's upper arm.
Thanks.
Can you go ahead and outline where we'll be making...
No.
Looks good to me.
What?
We'll be making a...
Restart! I'm
3/4
not! Nuh-uh. Nope. No. I gotta make it back there. I can skip ahead anyways, so. Hey, Chili, come here. Chili, come here.
Welcome to
Kitty
Surgery
baby.
Squad's
She's not.
virtual
She's not.
limited open carpal tunnel
Thanks,
release.
buddy.
Well, carpal tunnel...
Thanks, buddy.
The limited open carpal tunnel
I'm not
release
moving to
surgery
incision.
is
That's too
performed
far.
using a local anesthetic that numbs the carpal
I am stalling.
tunnel
I really
area
wanted
of the
to do
hand and
this
wrist.
part. This is
If
my
a
favorite
patient
part.
is nervous or uncomfortable, I'll sometimes use a sedative as well. A sedative is a
Chili.
drug given through an IV
Chili,
that
Chili, come
places the patient in a dreamlike state.
Chili.
However, our
What a
patient today will
fucking
only
ass.
receive the local anesthetic. Go ahead and get the operating area numb.
Okay, let's do it. Bam! Biff! Ow! Bam! Wait, stop stabbing him there! Holy shit!
With
I
the wrist
missed!
anesthetized, we can now begin
I
the
hit him
operation.
3 times
I've
in the
already
same
tied a
spot!
tourniquet around the patient's upper arm.
Stab,
Can
stab,
you go ahead
stab,
and outline
go,
where we'll be
whatever.
making our incision?
I'm a doctor! Let me sign this. T-O-M. Perfect! Tom did this one. Continue.
Looks good to me.
Thanks.
We'll be making a
I'm an
3/4 inch
artist.
incision at the intersection of those lines. Now take the scalpel and make the incision. Nice. I couldn't have done it better myself.
No!
Now we'll spread
Please.
the incision wider to expose the transverse carpal ligament. This band of tissue is the cause of the problems.
Please don't.
Place
I don't.
the retractors into the incision and spread it open.
Ah!
I think you're happy with this.
I
With the
can't.
transverse carpal ligament
Oh,
exposed,
shit.
I need you to slip a carpal tunnel guide into the incision.
Let's just put that there!
This is a blunt-tipped instrument
Why
with
is
a
it
groove
blunt?
on the upper surface
Cool.
to accommodate a special knife. The carpal tunnel guide is placed down the carpal tunnel and underneath the ligament and is used to protect the underlying nerve and tendons. Go ahead and push the carpal tunnel guide into place.
This is like medieval! Holy shit! Please don't! Ah!
Once in position, you'll advance our special knife and the guide to split the carpal ligament. As you push the knife forward,
Oh,
you will
my
feel it
hand.
cutting through the carpal ligament.
Oh, my hand. Okay, let's do that. Let's just drag the knife. Do it. Let's put the knife in. Ah, okay, we did it. Carpal tunnel.
With the transverse carpal ligament cut, the median nerve is no longer inflamed. Now we can begin to clean and close the incision.
Let's do
Go
that,
ahead
please.
and irrigate
Right now.
the wound.
Let's just spritz.
When you're finished, I'll release the
Oh, you're
tourniquet,
putting it in.
allowing blood to flow back into the hand.
Okay.
Great. Now you'll close the wound using non-absorbable sutures.
The nightmare hole is gone, guys. No more demons are coming out of that thing. Holy fucking shit! Yeah, guys, you better be sitting at your desks
With the
and
wound
typing
closed,
properly,
we'll
or
inject
this is gonna
additional
happen to
numbing
you.
medicine around the
Hands down,
operating
it's
site
happening.
to help relieve some of the immediate pain the patient may feel
Stab
after
him in the
surgery.
same spot like 8 times. Oh, I can't? Okay. Stab him again. Did I? I can't. Can't click anywhere else. Did I lose? I lost. I lost the surgery game that you cannot possibly lose at. I Tom lucked surgery. Shit. Does he really need 3? Can we just do 2? I can't fucking win. Okay.
With the transverse carpal ligament cut,
The demon hole's
median
back
nerve is
open.
no
Just a
longer
second.
inflamed. Now we
Redo.
can begin to clean and close the incision.
Okay.
Go ahead and irrigate
Spritz
the
it.
wound. When
Spritz
you're
it.
finished, I'll release the
You
tourniquet,
dipped it
allowing
in
blood
like
to flow
under
back
the
into the hand.
Okay, whatever.
Great. Now you'll close the wound using non-absorbable sutures.
Thanks. Non-absorbable? Why? Okay, whatever. I guess you're gonna have those
With the
stitches
wound
pulled
closed,
out later.
we'll inject additional numbing medicine around the operating site to help relieve some of the immediate pain the patient may feel after surgery.
Stab, stab, stab. He's okay, guys. Oh, did that break it again? Whatever, I'm skipping ahead.
We'll immobilize the wrist with a splint and a sling, and after 1 to 3 hours, our patient is sent home to
shit.
recover.
Cool.
Our patient needs to keep in mind that because of some of the medications we used, he may experience a bit of nausea. He will also be given pain medication to help relieve the discomfort he'll feel in his wrist.
Okay.
Once our patient returns home,
looks so
he'll
dumb.
be asked to follow specific instructions for driving, exercise, and medication. This will include keeping his hand elevated above his heart for the first few days after
Oh,
surgery.
shit, guys.
About 2 weeks after surgery, we'll remove our patient's
Yeah,
stitches,
that's what he meant by
and he'll be
non-absorbent.
gradually
Like, they
allowed
don't
to
just
return to his
disappear,
normal
you have to remove
routines in
them.
4 to 6 weeks.
Oh, that looks disgusting.
And that's a limited open carpal tunnel release
don't want
surgery.
carpal
Thanks for
tunnel!
stopping by. Why not try out some of the other amazing surgeries here on SurgerySquad.com?
Oh, versatile hair, let's do that one. Do a vasectomy. Woo! Okay, well, I guess we're done with that shit. Do the metal bar thing again. That was the worst. I didn't expect that. That was like horror movie, medieval grade terrifying. Like those horror movies where they like cut open your hand and they put bugs inside and you see them crawling on your skin. That was that. That was that. Oh my god, that was really bad. That sucked. Amateur Surgeon Twitchy, I've played already. Oh man, I don't even know. Oh man, I wish I had more. Like the most I could do is probably like the teeth ones. Dental filling. Oh, who wants to do a tonsillectomy? Who wants to fill a root canal? Who wants to do teeth whitening? That just sounds boring. Oh god, the toenail one. Who wants to do a C-section? I can't do a C-section. That's too many. It's not sexual. It's not sexy, but it's got sexual parts, and I'm personally not comfortable with it. No, I'm pretty sure I should just avoid it for Twitch.tv. Oh man. I'm gonna do tattoo removal. I haven't seen this one yet. Before you come in, roll them bones. Okay. That's totally not a dated phrase, idiot. I can do like 3
Welcome to
different
Surgery
breast implants,
Squad's
too.
laser tattoo removal. I'm Dr. Susie,
I'm
and
sure
I'll be
it's the same
assisting
for
you
every
with this
tattoo.
procedure today. According to a recent poll, over 50% of those with
adorable.
tattoos want at least one removed. They cited being too young when they got it, a new career, or significant
Where
life
is
changes, such as divorce or childbirth, as reasons why they no longer want them.
It's like poking
Luckily,
up,
there's
like,
laser
hey there.
tattoo removal.
Whoa.
Laser tattoo
Is that just
removal is a
edited on that
procedure
guy?
that uses a powerful laser that reacts with the ink of a tattoo to break it down into tiny particles. The laser directly targets the tattoo pigment and leaves the surrounding skin virtually untouched. After the ink is broken down, it is removed by the body's immune system, creating a natural-looking fade that typically only time or sun exposure would produce. Although laser tattoo removal is considered highly effective after multiple treatments, those interested need to keep in mind that yellow, green, and fluorescent tattoo inks are much more difficult to fade.
Crap. Don't get yellow, green, or fluorescent.
Our patient today is a male in his mid-20s that got a tattoo on his calf when he was a teenager.
Oh, what an idiot.
Now that he's older, he doesn't see the tattoo as being so attractive anymore. In fact, he's come to us to get it removed. So let's scrub in and see what we can do for him.
I like how they always say scrub in.
Before we begin, we need to go back in time to the day he picked out his tattoo.
What?
Help him pick out a real winner. Use the arrows to scroll through the tattoos. Click choose when you have made up your mind.
I think we found a winner. That's perfect. I gotta keep scrolling. Oh, Spring Break 99. Some gecko. Oh my god, that's pretty bad. What else is there? Type text here. I'm a big idiot. Ha! No, it's not. I don't want to do that one. Yeah, no, this is the best. That's the tattoo he got. Let's give him the tattoo so we can remove it. Yeah. That is disgusting.
I sure hope he didn't pay for that. What is that? Let's make that tattoo disappear. During our patient's initial consultation, it was recommended that he take a non-aspirin pain medication prior to the procedure to reduce any discomfort he may experience. Other than that, there really isn't any other preparation needed. So let's get started.
Let's just laser it off.
A lot of patients describe the pain from the laser as feeling like 100 rubber bands striking the skin at the same time.
Wow.
So to begin the procedure, we'll need to place a cold compress on the tattoo for a few seconds. This will help reduce the pain caused by the laser. Go ahead and place the cold compress on the tattoo.
Jeff's Instant Chill Pack.
That will do.
Good.
Now we need to use the laser to fade the tattoo.
I want that
Different
tattoo
types
so
of
bad.
lasers react with certain colors of tattoo ink. One laser might work perfectly for reds and oranges, but not so great on greens or black.
Oh, we've got some
So we'll
green.
use a variety of lasers to get the desired result. To help relieve some of the pain associated with the procedure, we'll also use a machine that blows icy cold air on the area being treated. Let's start by targeting any red or orange ink areas.
Zoot.
Next up is green, blue, or other darker colors.
Oh, I gotta re-click. I think we should leave it like that.
Finally, we'll remove the black.
Good.
Now that we've completed the first treatment, we'll need to place the cold compress on the treatment.
I did it already. Don't have to tell me more than like once.
You did great. Our patient is ready to go. Immediately after each treatment, the tattoo may feel sunburned, and it is extremely important to keep it covered until it heals. If our patient fails to do this, both his recovery and the results of the treatments may be negatively affected. Roll the bandage over the...
I did it!
As stated earlier, our patient's tattoo will only begin to fade after multiple treatments. So he shouldn't expect the tattoo to go away during one session.
Idiot.
While the tattoo may not be completely removed, it should be lighter and much less visible than before.
At that.
And that's laser tattoo removal.
Yay!
Well done. Why not try your surgical skills in another surgery here on SurgerySquad.com?
It looks 10 times worse. Oh my god. Okay, well it's not. Oh god. What about removing cancerous tumor? It's sad that they don't say it's breast tumor. Surgical breast implants, icy nipple. What is it? Botox we've done. Rhinoplasty is horrifying. Laser hair removal? Why is that a thing? Who wants to remove back hair? Let's try... Yeah, if anyone else wants to do this. I mean, there are some that are, like, with breasts and a C-section. So, I mean, there's some womanly parts. But, I mean, if you're fine with that, here's a link. Boom. I'm gonna post it under not safe for work, though. because I would not be doing this at work. I don't know why anyone would be doing rhinoplasty at work, but whatever. Not safe for work. It's probably like the only link I'll ever post is not safe for work. Look at me posting kinda porn in my channel. Not porn at all. Oh, let's do a tonsillectomy. Let's do a tonsillectomy. This looks bad. I still don't even have my tonsils removed, so I don't know. This is gonna be what'll happen. Hope it don't get
Welcome to Surgery Squad's virtual tonsillectomy surgery.
This will be bad.
I'm Dr. Jeff.
I'm leaving.
Today we'll be removing a young man's tonsils.
Uh-oh.
This is a common operation that's performed when a patient suffers from frequent bouts of tonsillitis. It's most often performed on younger patients, but adults can need it as well. The tonsils are located at the back of your throat on either side of the uvula. That's the little punching bag thingy that hangs down in the middle.
You're supposed to punch
Tonsils are infection
Hope
fighters,
you don't
but
throw up.
occasionally they lose the fight and get infected themselves.
Idiots.
They become red and enlarged and can sometimes make it hard to breathe and swallow.
Jesus Christ.
Normally we treat this with antibiotics, but when tonsillitis reoccurs frequently, we remove them because the infection can cause more serious damage. Our patient was given a sedative before being brought into the operating room, and the anesthesiologist will help put him completely under. Help me out and place a breathing tube in our patient's nose to assist with breathing while we operate.
Okay. Okay, where's the nose again? I got it!
We need to get our patient's mouth open wide so we have room to work. To do that, we'll use a special mouth gag retractor that opens the mouth.
It doesn't. It's probably all mental, but I mean, it feels like it fucking hurts.
Why don't you take a crack at that?
Okay, let's try. Have fun, idiot. Blah.
Great job. That should give us plenty of room.
Pretty good.
Now we have to reach in and grab the infected tonsil with the tonsil forceps. We need to pull it to the side to expose the connective tissue. Can you do that for me?
No. No, I don't want to. Okay, well.
Nicely done.
Oh, okay,
with the
that's
tonsil
stretchy.
extended out, we need to place this electrocautery device at the tonsil's base. The device
cauterize the
by
wound
removing the tonsils
that I'm about
this
to
way,
make.
We reduce bleeding and allow the patient to heal faster.
Yay, cauterizing.
Now that the tonsil has been cauterized, we reach in with a tonsil guillotine
we're doing this again.
The clamp severs the last of the connective tissue and allows us to remove the tonsil from the throat.
Bam! Oh, there's blood everywhere.
We'll bring the electrocautery device back in here and apply it to any bleeding areas. Because
what the fuck is going
this part of the throat heals quickly, we won't need any stitches.
Okay.
Now we repeat our steps on the other side of the throat.
That seems easy.
Extend the other tonsil with the tonsil. Just like the other side, we'll cauterize this tonsil to release. And finally, we need to remove the tonsil.
Tonsil guillotine, go! Slice. Oh no!
And don't forget those bleeders.
Those bleeders. Okay.
I'll clean out the mouth with some irrigation and suction, and then we're all done.
That wasn't that bad. It sounds like someone's sipping on the other end, like.
We'll send
like
our
it's just
patient
a bendy
to
straw
recovery
someone
for
has.
8 to 10 hours,
Delicious.
and more than likely he'll be able to go home later today.
Cats.
Once he's sent home, our patient will be put on a course of antibiotics. He'll need to keep hydrated with cold water or sports drinks. And if he gets hungry, he can have cool, soft foods like fruit pops, gelatin, sherbet, pudding, and of course, ice cream.
Yeah, ice
Getting
cream.
a little hungry? Thanks for stopping by SurgerySquad.com. While you're here, check out some of my other spectacular surgeries.
Wait,
always
spectacular!
Time,
I wasn't
informed.
informed. Let's replay. I mean, dude, laser eye surgery is like pretty bad too. Jelly. Please do wisdom teeth. Who wants to do wisdom teeth? I need my wisdom teeth removed, so it might be fun. Let's do wisdom teeth. Wisdom teeth. Wisdom teeth. Where are those? Yay! Oh, this looks painful. Yeah. Perfect. Okay, scroll up a little bit. Start. Do-it-yourself surgery. DIY surgery. You guys do it like that so you know you're stupid and you have a weird accent.
Welcome to Surgery Squad's virtual erupted wisdom tooth extraction.
I want to hear.
A wisdom tooth,
I want to hear
X-rays, or radiographs are
so
essential,
happy.
low-cost diagnostic tools used to examine a tooth's roots,
man.
check the health of the bone surrounding the tooth, observe the status of developing teeth, and locate abnormalities. Let's get started. First, insert a positioner into the patient's mouth.
face! Get the fuck over here! Come here! Get the fuck over here! I will destroy you! Okay. Oh, you did it! Why did you do that? Ah! Cat bot. Oh, hello, Chili. What are you doing? What's up? You're upside down, that is. Idiot cat. You're so cute. You're so cute. Oh, you. What are you doing? What are you doing?
Oh, that's bad. Okay, let's let you down. That's not. Oh my God, big baby. Oh, you don't like being upside down. Yeah, let's put you on my knees. You wanna go out? You wanna go down? Ah, you're such a big cutie. There we are. You good? Are you good? Yeah, perfect. Oh, she's happy. Wanna watch it? Oh, wait, you're not. Oh, God damn it. I guess she's more interested in that bag. Oh, whatever. Let's do this. Oh, I've had those in my mouth before. They're painful.
Next, position the X-ray cylinder where indicated.
Okay. I know how to do an X-ray. I've done this before when I was at
With the X-ray cylinder in place, we need to get behind our radiation barrier to reduce the amount of radiation we're being exposed to, and take the picture. Don't worry, a lead apron will protect our patient from any unnecessary radiation exposure.
What kind of TV exposes
I couldn't
you
have
to
done
more...
it better myself.
Holy...
I'll have my assistant finish up the rest of the X-rays, and then we'll view the resulting images.
Okay.
Well, everything appears to be normal with the wisdom tooth's roots. And now that all of the X-rays have been completed, we can extract our patient's wisdom tooth.
But Jesus Christ.
The two most common wisdom teeth extractions are for an impacted wisdom tooth or an erupted wisdom tooth. Patients that have two or more wisdom teeth extracted or have impacted wisdom teeth may choose to receive a general anesthetic. When a patient has an impacted tooth removed, the procedure is referred to as a surgical extraction. Our patient today is only having one erupted wisdom tooth removed and has elected to go with a local anesthetic.
Okay.
To begin, you'll need to apply a topical numbing gel to the anesthetic injection site. This will help decrease any pain.
Really digging deep in
Next, we can inject the local anesthetic. The patient may feel a slight pinch as the needle is inserted. After that, the area will become numb for a few hours.
Like the roof? Nope, still right beside it. Okay.
And now we'll give our patient a few minutes to become completely numb.
Duh. I thought I was going to do that for 5 minutes.
The patient's mouth is numb, and now we can move on to removing the wisdom tooth.
Oh, shit.
First, you'll need to loosen the periodontal ligament and elevate the tooth using a dental elevator.
A dental elevator? Oh, no. Why is it creaking? Ah!
Using the dental forceps, grip and rotate the tooth in a clockwise rocking motion until it's loosened and removed.
You literally just rip it out. Okay, let's do it. Seriously, why is it creaking? Ah! Why did
now
it creak?
Clean the area using a surgical suction. This will allow us to check the...
Seriously, just another guy on the end of this, like, tube going... Oh, blood! Oh, I love it. Let's do that. Yay! I hope somebody's gonna drink all of this out with this really cool bendy straw. Here we go! Yeah.
Everything looks great, but we're not done yet.
Oh, man.
Our patient needs to slowly bite down on some gauze for a few minutes to allow the socket to properly form a clot.
Are we just gonna leave that one alone and, like, we'll just leave it lopsided? She's happy. She's great with this. Are we gonna
Since
do
the patient is clotting properly, we can go ahead and place some fresh gauze in their mouth.
Mm-hmm. Do I get to do that? Ah!
When getting wisdom teeth removed, it's important to remember that everyone recovers at different speeds. The rate of your recovery depends on a number of factors, including the complexity of the extraction, your age, and your individual recovery capacity.
Okay.
Often, patients will opt to have their surgery on a Thursday or Friday, so they're able to return to work on the following Monday. After the surgery, the oral surgeon or dentist will provide some information tips that may help speed up your recovery. These tips may include using an ice pack on the outside of the cheek for the first 24 hours to reduce swelling, refraining from physical activity for the first few days.
Like punching children.
Avoiding sodas and the use of a straw.
Oh, no.
And gently rinsing your mouth out with warm salt water to help relieve pain after the first 24 hours.
Okay.
It's also suggested that patients do not smoke for at least 24 hours after their surgery. Smoking may not only delay healing, but it will also reduce the blood supply and could introduce germs and contaminants to the surgery area.
That's just silly.
And that's a wisdom tooth extraction.
We did it!
You did great. If you're up to it, why not try another procedure on surgerysquad.com.
I don't know if anyone sees the C-section one, but oh shit! Somebody's having a baby. Oh man. Sorry, not hardcore. I don't know. That's... I still have to get mine done. I thought they were gonna come through with the wisdom teeth, but nope. I still gotta get mine done. I'd like to do the C-section as much as I'd like to do the breast implant one, but I don't. I'm pretty sure that that is complicated, not fun times. I've done gastric bypass, but I'm pretty sure I can't do the C-section at all. I need someone, I need like one of my moderators to go do a C-section first and make sure there's no lady bits. And then I'll go do a C-section. It's hard, but I'm pretty sure as long as you don't show the outside lady bits, it's fine, maybe. Who knows? But in the meantime, I guess it's time to play other things. I'll do it. Leon vouches to do it. I'd almost turn on 18+. I don't even know how to do that, to be very honest with you. I've looked so hard for that. I'm an idiot. I probably just pass it up all the time. It's educational. Somebody's masturbating to it. Somebody's getting their jollies watching a virtual C-section. Root canal. Root canal! Oh, I'm ready. I'm ready for root canal. Who's ready for a root canal? Ah, this guy. Let's do it. Did you do eye surgery? I did. I did do eye surgery. I'm going to fall in love with that picture of afterbirth soaked baby, because I've seen it one too many times. It's disgusting me more and more.
Welcome to Surgery Squad's virtual root canal procedure. I'm the one and only Dr. Jeff, and I'll be helping you with this surgery today.
This counts as a game.
A root canal is an endodontic dental procedure
more educational.
That's used before we begin.
Anesthetic.
In effort to make our patient as comfortable as possible, we need to inject a local anesthetic into their gum line.
Very hairy
but first, apply a topical numbing gel to the injection site.
I've never had a root canal.
This
and
will
I've also
help
never had a
reduce
cavity,
any discomfort
so this will be weird.
Next, we can inject the local anesthetic. After the local anesthetic has taken effect, the area should become numb for a few hours. Use the syringe to inject the local anesthetic into the patient's gums. Just below the tooth we'll be performing a root canal treatment on.
Okay, let's do it. Biff! I've seen this before.
Let's give our patient a few minutes to relax and for their mouth to become completely numb.
You mean a flashgasm? Oh, shit. You haven't been into a dentist for 6 years. That's not good. Oh, shit, Alex Gamer.
Now that the patient's mouth is numb, we can move on to isolating the tooth. Since our patient's saliva contains contaminants that we don't want getting into the tooth, isolation is a critical step during root canal treatment. To isolate the tooth, we need to punch a small hole into the rubber dental dam and place it over the tooth.
Okay, I thought he was like holding that up, and then he's like, we're gonna need to punch, and my brain was like, I'll just punch him in the face, but hold this back so there's no blood getting on my fist or anything. It's totally not it.
Once the rubber dam is in place, put on a tooth clamp to keep it from moving.
Oh, a little tooth clamp. Oh, that's adorable.
Next, we'll need to dry out the tooth as much as possible using our air-water syringe.
What? Oh, it's just
so far, so good. Now that the tooth has been isolated, we can create our access cavity in the tooth using our drill.
The quality of that's horrible. Okay.
The next step is to clean and shape the tooth's canal using a root canal file. Go ahead and give it a shot.
Yay! I'm so glad he trusts me. Ah! Oh! Oh my god, that went right in. Holy crap. Okay.
At this point, the dentist would measure the depth of the canal using a combination of x-rays and specialized equipment. If a dentist fails to measure properly, It could mean that the tooth would be at risk for reinfection.
Oh, okay. Nothing
Now
about
we
death.
need to clean the canal of the tooth using sodium hypochlorite, commonly known as bleach.
Oh, okay, fine.
We'll
I just
let the
made
bleach
myself a
sit in
beer
our
and a
patient's tooth for about 5 minutes to make sure
okay.
that all the bacteria and tissue inside the tooth has been dissolved.
Okay. 5 minutes later. No elevator music?
Great. Now use the suction to remove the bleach from the patient's tooth.
Okay. Just some guy drinking it.
Next, we'll need to
brush
fill
my
the
teeth
tooth
more often.
using a rubber
Yeah.
compound known as gutta percha. Gutta percha is often preformed as tiny, thin cones that we'll insert into the clean canal of the tooth. I've already added some sealant to the gutta percha cone.
I'm
Let's
just
see what you
looking at a
can do.
match. I see a match, I'm sorry.
Looking good. A heated instrument is now
hockey?
used
I
to
don't know.
remove the excess gutta percha.
Well, okay, I apparently know nothing about root canals. This is all really weird to me.
Pack the gutta percha into the tooth canal using a plugger.
A plug? What the fuck? Okay.
After the gutta percha has been placed,
Huh.
it is common that additional x-rays are taken to
I did it with a
verify that
hammer.
the canal
Oh,
has been
God.
adequately sealed off. Once the dentist verifies that the canal has been sealed, a filling or crown is placed, depending on the location of the tooth.
Okay.
You can learn more about fillings and crowns in our virtual dental filling and virtual dental crown procedures here on SurgerySquad.com.
I didn't know there was much of a difference between the two.
After a root canal, patients should expect some mild sensitivity and discomfort. This can usually be relieved using over-the-counter pain medication, such as ibuprofen or naproxen. By brushing twice a day, flossing daily, scheduling regular dental visits, and avoiding smoking, it is possible to
Yeah,
greatly
guys.
reduce the need for a root canal. And that's a root canal. Why not check out some of our other amazing surgeries
Go
here
buy
on
surgery, go buy- I think we're done.
SurgerySquad.com.
I think there's nothing else we could do here, guys. The rest of them kind of sexy. Not at all. I'm gonna post a link again for all the surgeries if you want to check them out. Not safe for work. There is nudity, I would assume, especially with the breast implant surgery. I don't know if I want to do a C-section on Twitch. I don't think Twitch is ready for someone doing a C-section. I don't think that's a good idea, to be very honest. Oh my god. I think we should move past. I don't know, a C-section? That's... How about we save that? No, Leon, you can keep playing it. Have fun. No. I'll probably play it at the end of cast. Because then I could switch off the cast real fast and no admins can ban